Hi, I'm Dr. Kartik. I'm Head of Critical Care Services here in Yashoda Hospital, Somajiguda. So you can see this is our state-of-art advanced critical care unit. So this is a specialized zone where we have multidisciplinary teams working together to take care of life-threatening conditions. So in an intensive care unit, we have conditions where they range from a damaged kidney function to a damaged heart, a damaged lung, which require life support devices like ECMO, like ventilator support, like dialysis to take care of these sick patients. So this is a highly specialized zone and it requires cooperation from different branches to cater and successful and a positive outcome to the patients.
So welcome to the program, Dr. Kartik, and it's a pleasure to have you.
Pleasure is all mine, Dr. Lakshmi. Thanks for inviting me here.
Yeah. So critical care, I mean, it's such a fascinating field and also demanding. So what exactly do we mean when we say ICU? I'm sure it's associated with a lot of fear, a sense of urgency and hope all at once.
Yes. What you have said is absolutely true. So any hospital has an ICU. So all of us know that. So ICU stands for intensive care unit. So the reason why we say it is an intensive care unit because patients are pretty sick. They are having multiple problems which needs a coordinated effort in bringing out a successful outcome to the patient. So an intensivist job is delivering the same. So we are here round the clock 24/7, 365 days, you name it. It's a festival, it's a Sunday, doesn't make a difference. It's an emergency field and we ought to be here any point of the day. So we are here in the ground taking care of the patient, coordinating with multidisciplinary team that involves different fields of medical profession and specialties. And we try to bring out patient condition and transition them from the bedridden state to a state where they can be discharged out of the hospital. So that's basically, to sum it up in a simple words, this is what an intensivist does in an ICU.
So apart from not just being a doctor, you also have to be a detective, I believe.
Yes. I would say yes, that's a correct assumption. So a detective's job is to find out where the problem lies with the clues that you have at your hand. So we have clues in types of the lab investigations, the diagnostics, which help us in bringing out the real diagnosis or real problem that the patient is facing so that we can cater our treatment appropriately and precisely to the patient. So yes, it's a detective job.
Yeah. So tell us, what are some common reasons or some common conditions that people, unfortunately, they land up being in the ICU today?
So the common reasons that we have in our critical care team, patients coming up and our critical care team treating these patients are basically sepsis. That's the number one reason for admission in intensive care unit. So if you see sepsis is a condition where the infection goes haywire. So if you have an infection, but your body reacts to it in a violent way or in a dysregulated way, which causes organ dysfunction, or in simple words, your organs start failing because of infection, then you term that condition as sepsis. Then nevertheless, there are organ dysfunction of other sorts like lung failure, heart failure, or a kidney failure.
So, మీరు చెప్పినట్టుగా, you get to treat so many lot of emergencies, playing the detective role, అసలు పేషెంట్కి ఏమవుతుందో కూడా అర్థం కాదు. సో ఇదంతా ట్రీట్ చేయడానికి I'm sure you require a huge team. So what exactly is happening behind the doors of the ICU? అసలు how does it work?
So where do I start with? It's a huge job. So I've come to this profession 12 years back, and every day is a learning curve in intensive care unit. I've seen so many sad stories, so many successful stories, and so many people have gone up with a smile on their faces. And this has been only been possible with a multidisciplinary team. If I say that I have treated the patient, it's very wrong. It's the whole team's effort. The team involves not only the doctors the nursing staff, the respiratory therapist, the physiotherapy team, the dietitians, and even the housekeeping managers, housekeeping staff play a major role in making this successful journey become a realistic possibility. So it's a team effort. Without a team effort, you cannot achieve miracles and wonders like your Indian cricket team, right? We have won the World Cup recently. So that's sort of teamwork that we require if you want a successful outcomes in an ICU.
సో హౌ డు యూ సీ క్రిటికల్ కేర్ టుడే? అంటే ఇంతకుముందు ఎలా ఉండేది అండ్ ఇప్పుడు మనకి రీసెంట్ అడ్వాన్స్మెంట్స్ ఆర్ రీసెంట్ ఎక్విప్మెంట్స్ టు సేవ్ సమ్ critical conditions, how did it evolve?
Along with our clinical equipment, along with our judging capacity and diagnosing capacity, the science has evolved leaps and bounds till now. So now you are in an era where you are thinking about advanced life-saving interventions. Say, for example, ECMO, which we didn't have few years back, in India at least.
Yeah.
So ECMO is a machine which supplies oxygen to your body when your lung is not able to present that oxygen in your organ system or in your blood. So
Wow, that sounds so fascinating.
yeah, that's true. So ECMO is a machine which stands for extracorporeal membrane oxygenation. So you must have read in newspapers or in your media about this equipment, and many high-profile personalities have been undergoing this ECMO. So the ECMO machine itself helps you in two main things, that is supporting your lungs and supporting your heart. So if you have to support the lung, when the lung is failing because of infection, because of ABC, there are many conditions medically that we can explain. But the main point is, if your lung is failing, you usually go on to ventilator support. That is what we see in the movies and in our regular television. Now, suppose your ventilator is not able to deliver oxygen when it's on the highest possible numbers, then comes the role of ECMO. So the ECMO supplies oxygen directly into the blood. So that buys time at your hand.
So it's basically giving your lungs some
Yes.
time and some rest, which is much needed at that.
Yes, you're buying time till which you can adjust your antibiotics and get rid of this infection, and then the support can be weaned off. So they basically a supportive therapy, but a very, very valuable time for the patient, and it extends that time that we buy to improve our patients out of this dreaded complications.
This is definitely sounds so fascinating, and it's definitely a remarkable thing which has come up. So tell us some interesting story what you have recently come up with ECMO.
Right. So there are innumerable stories. One is coming to my mind when you ask this question. It's about a woman, a middle-aged woman. She's a software engineer, and she had been recently to a place where the war is going right now. And she's flown back to India with complaints of cough, cold. So yeah, simple. So we feel that cough, cold is something that we can treat at home.
Yeah.
But now I was referring to the same point earlier, that is sepsis, right? So this patient had infection which turned out into a sepsis where there is immune response was dysregulated, and she landed up with pretty bad lungs. So when she came to our ICU, she was gasping for breath, and we had to keep her on ventilation support. But our surprise, even the ventilator could not deliver her the oxygenation. So immediately it was in the wee hours of the night that we had to cannulate her and try her on an ECMO. So we delivered her the ECMO provision, which is there in the hospital, and very few hospitals have the services and the clinical skill to do ECMO in nowadays. So she was treated on ECMO for 5 days, and then she improved, and we could decannulate her from the ECMO, we could remove her ventilator, and we could send her back to the work. Now she is doing her IT job right now and keeps meeting us once in a year at least. She remembers all the nursing
She's
staff.
grateful, definitely.
Yes,
she's
yes.
very-
She's a mother of 2 young children, and the whole family is happy, and she has a long life ahead of her because of this miraculous recovery she made with help of this advancement of science that we are talking about in form of an ECMO device.
So ఈ స్టోరీ ఇది విన్నాక it definitely sounds very frightening but also very hopeful at the same time, because a simple infection landing up being on the ECMO, but ECMO saving the life, and it's definitely a miracle. That's truly fascinating. So you've mentioned about the transplant, that ECMO is the bridge during the transplant. So how do you see, transplant is another fascinating and a promising specialty. Um, so what is your take on transplant?
Transplant is a life-saving intervention, right?
Giving second chances at life.
Yes, it is life-saving intervention for those people where there is no medical therapy available right now for improvement of their organ dysfunction. Now, general public also have to know that transplant is not a simple thing. So it requires a lot of care before we do transplant, while doing a transplant, and after we do the transplant. The patient has to maintain certain style of lifestyle to medications and general precautions that they need to take. Nevertheless, it gives them that life that is valuable, and the family of such patient is benefited a lot with this transplant services. Primary underlying message that you should know, that if you are suffering from a disease where there is the scope of medical therapy is exhausted, and the only way to go ahead is to change the organ to a healthier organ from a donor, then the transplant services come into the picture. So the transplant services again requires a team. It's a team effort, right? So it requires your transplant surgeon, it requires a transplant physician, it requires a critical care physician who is at the helm of the affairs, and it requires a supportive team. Like I have told, in an ICU, the dietitians, the respiratory therapists, the physiotherapists, they all play their unsung heroes somewhere in this program. So that's a team effort again. So that's a specialized field again. Yeah.
So tell us some transplant survivor story that, it has really inspired you and that gave you maximum satisfaction looking at them.
Right. So I'll pull out another story for you that recently we have seen. So this boy was a young male who came to us. He was age of around 14 years old. So this boy unfortunately consumed paraquat poison. So if you know about paraquat, it's a lethal poison where there is no antidote for that poison, and it affects the lung, and the lung goes into an irreversible damage. So we could save this boy with help of a lung transplant. So the boy's family was very understanding. They understood what they are getting into and what are the precautions that they have to take post transplant, and we counseled them, and then we could maintain him on awake ECMO. So that's what you were asking in the previous question. So we could maintain him on awake ECMO, and luckily the boy had availability of donor where the lung were available, and we had to size the lung according to the size of his lung. Yeah, that's a technical aspect. The surgeons will challenge that the lungs transplant in such young age requires, and we could do that and transplant the lung to this boy, and this boy is now healthy. And I wish I could show you the video where he's running on the beach with the transplanted lungs. And yeah, that's some incredible story where such unfortunately young people, when they consume this poison, there is an option there available for them as well.
So definitely ECMO and transplant medicine has given the boy and to many patients a second chance at life. So when you said, the parents were understanding and willing to undergo this, I think that's important, awareness and knowing what's happening. So how do you think the awareness about be it ECMO or transplant or critical care is among the general public?
General public. So this is something, it's a very difficult thing that you have asked. Now, awareness will come with doctors, community, and healthcare providers together passing this message to general public. So the general public has to know that the medical advancement in a field of medicine is growing leaps and bounds. So we have this facility of ECMO transplant services. So the way we go about informing people is through the podcast or the podcast that we do right now. One we are doing here. This is one way of reaching out to them. And at a society level, we have critical care societies, we have physician societies, pulmonology societies, where we create a public awareness. So we go to the public and we explain them what these interventions are and how they can be beneficial. And media plays a larger role in propagating the knowledge about these facilities and medical care that is available to the general public. And even patients are now smart. This is a world of artificial intelligence. They are onto their Perplexity apps and Capgemini apps, and they already come to us with an idea about what these services are and what it takes to undergo these services. Yeah.
So critical care knows no age and no boundaries as well. So is it true that, we get to hear that the patient is being picked up from some other state or be it other country and being airlifted and getting treated? So how do you see that?
So this is something that we have been doing since the COVID era, right? So we had every place is not equipped with specialized medical care. Unfortunately, there are pockets of centers across the country where there is quaternary care of treatment and medical facilities available. So our hospital is one such institute. So many people from distant places want to reach our hospital for medical services that we cater. So to those patients, we have something called airlifting in an air ambulance. So our medical team, whenever we get a distress call from any of that such periphery hospitals where they require the specialized care for those patients, the family, the referring consultants contact us, and our team from our hospital flies in a air ambulance to those places to pick those patients up in ailing conditions. They are not healthy, they are not stable, but we go there, we deliver these patients with this advanced care. We pick those patients up from the peripheral centers and we fly them back to our hospital and continue the medical care here. So one boy right now, he's in our hospital. So he's been lifted from the state of Chhattisgarh. So our team had gone there and this boy was pretty sick. He was on ventilation support and he was not able to maintain his oxygenations. His blood pressures were crashing. He had kidney failure requiring dialysis. So he was basically, in medical language, what we call multi-organ dysfunction. So he's pretty sick. So we had to send our team, and the team comprised of intensivist, a cardiothoracic surgeon, a perfusionist, and paramedical staff who have gone there, who had initiated the patient on ECMO service and ECMO facility.
Then and there.
Yes, then and there, then and there. And then they have cannulated the patient and they have lifted that patient in that dire condition onto an air ambulance, and through that aircraft they have brought him here. And the patient now has been treated for the last 9 days, I suppose, and he's been off ECMO and doing well on a tracheostomy in the ICU.
So how do you feel, looking at so many patients getting discharged successfully, coming in a critical state where with so much uncertainty, but going back home healthy? So how does it feel? Does that give you goosebumps just like lifting the ICU World Cup trophy?
So let me tell you in a two-part answer to this question. It's very rewarding. The very fact that we have come into this field is to do certain things which brings happiness across face of our patients and their families. So it's very rewarding when we see patients coming out of such dire emergencies and conditions and going back, reuniting with their families and coming back to us and remembering us. It's like mesmerizing, and it's very, very fascinating to know that they're doing so well. And somewhere this is where advancement of science have gone to, and it's increasing your longevity, it is increasing productivity of every citizen, and thereby it helps in building up your nation's progress as well. It's a part of the progress story of our country. So the healthcare facility is very, very important, and as a doctor, when we have those success stories, we remember them, and certain patients are with us for our lifetime. So they will be coming back to us all throughout their life, and we'll be celebrating their success stories. And somewhere we are unfortunate to lose few in our journey, but they also teach us an lesson or something that we could do better in our next patient and achieve that success.
I can clearly see the spark in your eyes and the smile on your face as you talk about the journey of those critically ill patients. So, before we wrap this episode, Dr. Kartik, what is that one message you would like to share with our viewers out there and that they would like to remember from this talk?
Whenever you have a patient who is having multi-organ problems, who is very sick, please remember that there is a critical care physician who can help you out in bringing out this patient. So they cater a multidisciplinary treatment to your patient. That is, we create a platform in critical care units, in ICUs, in bringing a success story to you. So we create that platform for multidisciplinary departments. It's not only us, but along with us, the physicians, surgeons, and the other specialties together can be taken on board and deliver you the result that you intend to get for your patient.
So, thank you, Dr. Kartik. It was wonderful having you here, and thank you for such an interesting conversation.
Right. Thank you, Dr. Lakshmi, for having me on your podcast, and thank you to your team for having me. Hopefully, I could answer few of your questions to your
Definitely
satisfaction.
make a few difference in some of the lives.
Pleasure is always mine.
Thank you.
Thank you.